First of all, I'm very grateful to Gupta ji and the patient union for having me here. I won't be going into the symptomatology and other things because I'm a public health practitioner, so I would be just focusing on how the government has been able to do for the long COVID. The guidelines were released, everything was released, but this kind of crisis, because it's a silent health crisis which we are encountering, the incidents and other things which are reported in the news and the media, you see that the young people who were not having problems, now they are exhibiting problems. Having seen the worst industrial tragedy, I think Professor Verma is here. I think you have joined afterwards. At that time, I got admission in Gopal Medical College. The worst MIC tragedy was there. And to understand that at that time, a lot of investment happened in the form of many hospitals coming up. You had many hospitals there which are trying to see the long-term impact of MIC gastritis. Still, the hospitals are functioning. But after the COVID, except the 5 ICMR centers, which are now tracking and trying to develop a registry, we could not find a long-term that kind of intelligence coming to us and informing us. After releasing the guidelines, are these guidelines enough? Are we able to capacitate the medical officers? I have seen the H1N1, the Bhopal tragedy, and now this COVID, having worked closely with Dr. Paul in managing the COVID pandemic, is business as usual. We have given a revised surveillance strategy for monitoring the patients and other things, but it's business as usual. And the guidelines which are there, we have to see that how these guidelines are actualized, so that the detection of this long COVID happens as a reality. We are talking about 1.4 billion people. How many people are there in the tier 1 cities, tier 2 cities, or the national level institutions? How many people they can come? And as rightly pointed out by Dr. Dhamija sir, that means that the brain health is a very important contributor for the economy as well as the development. We take pride in saying that we are having the biggest demographic dividend. But this hidden crisis which we are facing, if we are not able to address that, can we just celebrate the demographic dividend which we are having? Because the productivity, the economic losses and other things are there. You look at the capacity of the people who used to work 8 hours, now after 3-4 hours he is exhausted. And what we are doing for that? We have to think from that perspective. Though government has made a lot of measures, we are trying to strengthen the surveillance, we are trying to issue clinical guidelines, we are taking research initiatives, we are doing capacity building, we are doing mental health initiatives. We are doing many things, but what is happening? We have to see that how this all becomes an actuality. How to build capacity so that things happen. We have created guidelines, we have created modules, and iGovt platform is there. And what is the uptake of this iGovt platform? How many patients we are able to detect? How many patients you are able to help in overcoming that? Are we able to address the issues of the exhaustion, the issue of weakness, the issue of tingling, numbness, issue of brain fogging? Brain fogging is very common among the young generation. What are we doing for that? We have to think from that perspective. As a policy person who is contributing to policies, we have to think and how to bring that into the discussion, narrative. If you are able to bring this into the narrative, at least half of our job is done. So that discussion and bringing into the narrative, that's the thing which we have to do. Second thing is we have to build capacities also. Capacity for detection, because under detection is there. Consolidating the fragmented care which is currently available. Then the research gaps which are there. We have to see that how we do that. And there are policy blind spots in the long COVID management. It's not only pertaining to the Apex institution. We have to see that how it goes down to the district hospital, sub-district hospital, right up to the Ayushman Arogya Mandirs, which is the focal point for making the wellness and the well-being as an actuality. So you have to see that how we can work, because unless we invest into this, the demographic dividend which we are all celebrating, we won't be able to celebrate that demographic dividend if we are not able to invest into this. Thank you very much once again for this opportunity.